the the disease burden at the national level, at India level, it is growing at 12 to 15% annually. If the government has taken a decision to promote Indian medical tourism to other countries, it's a really big boom. The finance minister has really done a fantastic job for these elderly care people. The coverage, by increasing the coverage and also increasing the cancer centers in the rural areas, and also upgrading on the digital health.
नमस्कार हेल्थ लाइफ के इस वीडियो में आप लोगों का बहुत बहुत स्वागत है। टुडे आई हैव मिस्टर महेंद्र हु इज द ग्रुप सीओओ ऑफ ओमेगा हॉस्पिटल्स विद अस एंड वील बी आस्किंग लॉट ऑफ क्वेश्चंस रिगार्डिंग द हेल्थ सेक्टर and what all benefits are people getting with whatever has been happening recently in the budget day. So first question that I would like to ask you is, what do you think, what is your opinion regarding the exception on duty for the life-saving critical drugs?
Yeah. So before I answer that question, my viewpoint is overall Indian Union budget 25-26, especially in the healthcare sector, is a high focus on the accessibility, affordability, and developing the Indian healthcare infrastructure. So coming to the question what you asked on the life-saving drugs, I think there is a complete custom duty exemptions on this life-saving drugs. I think they've listed around 36 drugs, which is having the regular drugs and they also on the cancer care drugs. This would really help the population at large, who especially spend the money out of pocket, and the taxes have come down, and it is also useful for the government to procure the things, and especially for the private hospitals also it will be more accessible and affordable to the population at large, especially the cancer patients.
Right, sir. Speaking of cancer, sir, we have got to know that there are more than 200 cancer daycare centers right now. If you can just talk about it, sir, what is a cancer day care center to start with, sir?
Yeah, just to give you a background, I think government was quite have done a lot of groundwork on this to create and establish for 200 cancer care centers. So the disease burden at the national level, at India level, it is growing at 12 to 15% annually, and the disease burden is so high across India. The cancer centers, establishing these cancer centers is very needful now. So when I say daycare centers, it would be like under daycare there will be a chemotherapy centers, there will be a non-cancerous cyst removals and surgical procedures would be there. So basically, this daycare centers would cater to as a giving chemotherapies to the patients. At the same time, small surgeries which is related to cyst, which are benign cancer procedures, would be useful in it, and also a short stays procedures would be there in these centers. But what I strongly feel is, apart from this, if government might be working on that, if this daycare cancer centers can also focus on the preventive aspect of the cancer center. So prevention of the cancer initiatives can be a part of this daycare center, so that people come to the centers as a part of prevention also, so that they know that at what stage they are. They're talking now about the curative centers, but I'm also talking about the preventive centers also. That will be very useful, because it will be these cancer centers will be setting up in the district hospitals, especially in the rural areas and undeserved areas. So this would be a win-win situation, and it's a game changer in the cancer as a cancer specialty for the population.
Sir, another interesting thing that has been witnessed is that there has been an increase in the medical seats, and there's also been an increase in the medical staff. So if you can just talk about it a little.
Yeah, you see, here the doctor-patient ratio has a very huge gap in India. So keeping this in view, I think government has worked out on getting more number of doctors, and also they have increased they have planned to increase 10,000 medical seats this coming year, and over a period of 4 to 5 years, they want to increase up to 75,000 medical seats, which would be a big boom. And this gap of doctor-patient ratio will really come down, and this would help most of the patients accessible to the doctors community. And the percentage, I think, on average there will be around 12 to 13 doctors for every 10,000 patients, 10,000 population. So that gap would definitely would come down by increasing these medical seats.
Right, sir. Sir, we will also get into the medical tourism that is happening in the country. Heal in India concept. If you can just talk a little bit about, how as more people are coming to get their treatments done, how is it, number one, cost effective? How is it, effective in terms of the treatment that they are getting from the doctors of a country?
So this heal in India concept is actually the most welcoming thing, especially for the private health sector. Uh, if the government has taken a decision to promote Indian medical tourism to other countries, it's a really big boom. I expect at least there would be an increase to 5 to 10 fold in the Indian medical tourism industry in the coming year. Once the government start promoting on the services, the kind of services Indian healthcare industry would give. So this would place our country as a premium destination for extending high tertiary care services and quaternary care services, and which not only useful and benefit to our Indian hospitals or Indian population, but also the international patients coming from other countries. So, because the cost of a basic procedure is also very, very high in other countries, and at less than a 20-25% we'll be doing in India. So, I strongly feel that the government promoting Heal in India concept would really grow very fast and would be very useful for the other countries also.
So we'll also get into the insurances that are being done for the senior citizens. Firstly, I mean, for the people who are above 60 years, earlier it was 3 lakhs. Now it is minimum of 5 lakhs. Sir. What do you have to say on this? And is there anything that has been missed when there has been such a progression in, the payment of the expenditure in the insurance that is being provided?
You see, again, when it comes to the elder care, always the focus was on the elder care. But I think this year they were very clear. The finance minister has really done a fantastic job for this elderly care people. The coverage, by increasing the coverage and also increasing the cancer centers in the rural areas, and also upgrading on the digital health, all this together really helps the elder care to access and get more accessible to the healthcare, the tertiary healthcare, and it also gives the affordability component also, as they come down with some 5% concessions on the essential drugs. So the increase of coverage would reduce the out-of-pocket expenses for the senior citizens, especially the elder care people, and that will be very, very useful as we see the elder care percentage on day by day it is increasing.
Last thing I would want to ask you is that when we come to Ayushman Bharat, there has been a certain price increase that has been noticed in the same. If you can just give your thoughts on this, sir.
Maybe last 5-10 minutes we were talking about the key hits, what the budget was talking about. I think there were one or two misses, but I can't say it misses. But at least next coming budget, next coming financial year, they might look into. One is about the Ayushman Bharat scheme, the PMJAY scheme. The procedures, the healthcare players were expecting there will be some increase in the price, which actually it has not been done. It has come down actually. That is one part. So a little bit increase in price so that the clinical outcomes, we focus more on the quality side, and the acceptance of these schemes would be very well with the private sectors, which I still feel the pricing part has been missed. That is one part. Second thing, as the government spoke about so many cancer centers, establishing so many cancer centers, and they also have come down with the custom duties and taxes in the cancer drugs. But I strongly feel they missed out on the equipment part, the linear accelerators, the custom duties. We thought there would be some exemptions on the custom duties, which has not been done. Maybe I expect and definitely foresee that the next coming financial year these things would be taken care, so that the overall the overall the budget looks very good, and we welcome this budget. But there's one or two points which I felt that these are the misses.
Thank you so much, sir. Thank you for your time. It was great interacting with you.
Yeah, thank you, Harsh, and thank you for your time. And okay, thank you.
तो ये थे हमारे साथ मिस्टर महेंद्र हु इज द ग्रुप सीओओ ऑफ ओमेगा हॉस्पिटल्स। उम्मीद है कि आप लोगों को काफी कुछ समझ में आया होगा रिगार्डिंग द हेल्थ सेक्टर, क्या क्या प्रोग्रेस हुआ है एंड क्या कहना है आपका इसके बारे में, हमें कमेंट सेक्शन में जरूर बताएं। थैंक यू सो मच सर।